Hello and welcome. Today we're diving into a potentially serious condition affecting the male reproductive system, the prostatic abscess. We'll explore what it is, how it's diagnosed, and what treatment options are available. So, let's get started. The primary culprit behind a prostatic abscess is typically a bacterial infection. These infections often stem from untreated or poorly managed bacterial prostatitis and inflammation of the prostate gland. The bacteria most commonly involved are gram-negative organisms, such as E. coli, Klebsiella, Proteus, and Pseudomonas. In some instances, Staphylococcus aureus, a gram-positive bacteria, can also be responsible. Other less common causes include complications from prostate biopsies, instrumentation of the urethra, or even spread from infections elsewhere in the body, particularly in individuals with weakened immune systems, like those with diabetes or AV. Let's break down the pathophysiology. Bacterial infection triggers inflammation within the prostate gland. This inflammation leads to the formation of a localized collection of pus, the abscess. The body's immune system attempts to wall off the infection, but the resulting inflammation and pressure within the confined space of the prostate can cause significant pain and dysfunction. The abscess can enlarge, potentially rupturing into the urethra, rectum, or perineum, leading to further complications like sepsis or fistula formation if left untreated. While the exact numbers are difficult to pinpoint, prostatic abscesses are relatively uncommon. They are more frequently seen in men aged 30 to 60. Certain risk factors increase susceptibility, including diabetes mellitus, immunosuppression such as in HIV-infected individuals or those on immunosuppressant medications, chronic indwelling urinary catheters, and a history of recurrent prostatitis. It's important to note that the incidence has decreased somewhat with the widespread use of antibiotics to treat prostatitis. The symptoms of a prostatic abscess can be quite varied, but often include a combination of urinary and systemic manifestations. Patients may experience difficulty urinating, dysuria, frequent urinations as frequency, urgency, and nocturia, frequent urination at night. Pain in the perineum, lower back, pelvis, or rectum is also common. Systemic symptoms can include fever, chills, and in severe cases, sepsis. Some men may also notice blood in their urine as hematuria or painful ejaculation. Diagnosing a prostatic abscess typically involves a combination of physical examination, laboratory tests, and imaging studies. A digital rectal exam (DR) can reveal a tender, swollen, or fluctuant prostate gland. Laboratory tests, such as a complete blood counts at CBC and urinalysis with culture and sensitivity, can identify elevated white blood cell counts and the presence of bacteria. Imaging studies like transrectal ultrasounded TRUS or MRI are often used to confirm the presence of an abscess, assess its size and location, and rule out other potential causes of symptoms. Prostatic abscesses are not typically classified into different types in a formal sense, but we can categorize them based on their etiology, e.g., diabetic-related post-biopsy size, a small vest, large, or location within the prostate gland. However, the primary focus is always on identifying the underlying cause and tailoring treatment accordingly. The cornerstone of treatment for a prostatic abscess is antibiotic therapy. Broad-spectrum antibiotics that effectively target gram-negative bacteria are typically initiated, followed by adjustment based on culture and sensitivity results. Drainage of the abscess is also crucial. This can be achieved through transurethral resection of the prostate, a TURP, transperineal aspiration, or open surgical drainage. Management also includes supportive care, such as pain relief, hydration, and monitoring for complications like sepsis. In cases of urinary retention, a temporary urinary catheter may be necessary. It's essential to complete the full course of antibiotics as prescribed to prevent recurrence. Preventing a prostatic abscess primarily involves prompt and effective treatment of prostatitis. Men at high risk, such as those with diabetes or immunosuppression, should be particularly vigilant about seeking medical attention for any symptoms of urinary tract infection or prostate inflammation. Regular follow-up with a healthcare provider is also important for men with chronic prostatitis. Proper hygiene can also help reduce the risk of urinary tract infections. The prognosis for a prostatic abscess is generally good with prompt diagnosis and treatment. However, delayed treatment can lead to serious complications such as sepsis, fistula formation, or recurrent infections. Recent research focuses on optimizing antibiotic regimens, refining drainage techniques, and exploring the role of minimally invasive procedures. Some studies are also investigating the use of novel imaging techniques for earlier and more accurate diagnosis. Ongoing research aims to improve outcomes and reduce the risk of complications associated with this condition. Thank you for joining us today.